Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. I'm joined again by Lanette Siragusa, Chief Nursing Officer and Provincial Lead for Health System Integration and Quality for Shared Health. Today, 3 additional deaths are being reported. A male in his 80s from Winnipeg linked to a Victoria Hospital outbreak. A female in her 80s, both from Interlake Eastern, linked to Misericordia Place outbreak, and a male in his 40s from Interlake Eastern. I want to extend my condolences to their families and loved ones, as well as to the 3 individuals whose deaths were announced on Tuesday. The current 5-day COVID-19 test positivity rate in Manitoba is 7.3%. 170 new cases of the virus have been identified as of 9:30 a.m. 1 case was removed in data error, which brings our net new number of cases to 169 and brings a total number of lab confirmed cases in Manitoba to 4,701. Winnipeg regional health test positivity rate is 8.6%. And with the lower denominators, the sample sizes there, this is less a reliable number, especially if we got into some of the other regions. So we'll use that number in context. In partnership with the Chief and Council from Cross Lake First Nation, provincial public health officials are advising that multiple individuals in the community have tested positive for COVID-19. The cases are related to previously announced public exposures, including a funeral, and have led to a high number of close contacts. Public health officials are working with the community and other partners to address the situation. The community has been moved to critical or red on the pandemic response system. Chief and Council have directed that public gatherings are not permitted. Community residents are required to stay home. People should leave their residence only to seek testing or medical care, or to send 1 person from a household for essential supplies. People who work in essential services are exempted. Masks must be worn outside of the home. So again, as we see our numbers continue to climb, the message is again that we all need to do our part to reduce our contacts outside of our household. And this means reducing the amount of people we're socializing with outside of the house. We're seeing a lot of cases linked to gatherings over Thanksgiving. In one example, we have 7 cases identified from attending just 1 dinner for Thanksgiving. And so we can see how our close contacts can quickly become cases and more contacts. We're seeing people linked from traveling from one area to the province to another to visit family, only to bring that virus with them. We're seeing cases linked at social gatherings for people who are sharing items, and one recurrent example is vape pens. And we are again seeing people who are showing symptoms of COVID-19 but are out and about to the store and running errands. So again, we've always reminded Manitobans to not stigmatize, not to shame, because there is no shame or need to stigmatize. It doesn't help our efforts here. We're sharing this info to see how important it is and how easy it is to spread COVID when we're not on guard at all times. So we need people to continue to do their part, and we know it's been going on for quite some time. It's hard to stay focused. It's hard to adhere to these measures, but we can see that by not adhering to the fundamentals, we're spreading this virus. We're causing harm in many individuals. It's been challenging times. It's not always going to be like this. We will be back to normal, but right now, that isn't that time. We need to continue to focus on the fundamentals. And it's very, very clear that we are not moving in the right direction. And again, that question you can ask yourself is, in the last week or even the last few days, how many people have you been in contact with outside of your house? If public health asked you that question, would you be able to give a reliable answer? Would it be a long list? Those are things we need to continually ask ourselves, because if that's a long list or it's too long to even recall, that's too many contacts. And so that time to act is right now. Right now, today, we can all put measures into place to protect us, to protect the people around us, to protect our community, protect our healthcare workers. We need to stop socializing with people outside of our household for now. People who are at increased risk of severe outcomes, those over age 65, those with underlying health conditions, need to consider staying home for the most part, leaving for essential reasons, ensuring you're practicing the fundamentals, hand washing, physical distancing, wearing a mask when you are out. But we're seeing this virus being transmitted in the community. We all need to take measures right now, especially those that are at increased risk for severe outcomes. Halloween is coming up. On Saturday, Public Health has already provided guidance for how you can take part safely. Again, these are guidelines. Everyone needs to consider their own level of risk. If you're feeling well and feel like going out, if you respect the group size numbers, the physical distancing, wearing a mask, then do so, and do so by practicing those fundamentals. No one should be holding a Halloween party indoors. Certainly virtual parties, connect virtually, find innovative ways to enjoy the time. But we've heard many reports of planned Halloween parties, and we just can't have this now. We've seen this spike, a lot of it related to Thanksgiving. And you've heard of 7 cases related to just a single gathering. And there's probably many more to come from that gathering, and there's many more such gatherings that have cases. The same thing will happen with Halloween. We just cannot be socializing like that outside of our household. So please, if you're going to celebrate Halloween, have fun, find innovative ways, but do it safely. We've been through those fundamentals: washing your hands frequently, practicing physical distancing, wearing a mask in indoor public places, staying home when you're ill. And we've just seen so many examples, unfortunately, of this virus spreading because of non-adherence to that principle of staying home when you're ill. So please keep that in mind. Even if you're mildly ill, go for a test, self-isolate pending results. But we can't have people going to school or work or shopping or other gatherings when they're ill. Just a couple updates on a few of the other outbreaks. For a Parkview case, the total number of cases is at 126, including 94 in residence. Heritage Lodge is 20, including 15 in residence. Maples personal care home is at 61 total, with let me see here, I believe 55 residents. St. Boniface E6 is at 15 total cases, E5 at 7, and B5 at 1. Victoria General Hospital is at 28 cases. So just a quick run through of updates there, and I can pass it over to Lanette.
Thank you very much. Good afternoon, everyone. Today I wanted to devote most of my speaking time to discuss the current staffing situation in the healthcare system, as well as some of the strategies we are using to build capacity and support our workers. First, I did want to give an update that the capacity is continuing to be further stretched. Our ICU, I just checked before we came in, is around 92% occupancy, which was higher than on Monday. And I can also report that we have canceled 43 surgeries. Some of them are because of staff who are at home isolating, and others are in relation to changes we have made to protect our staff in using PPE, and I can give you some more details about that. The majority of those cancellations were at St. Boniface Hospital. And so we do continue to have beds and equipment and supplies, but our most precious resource right now is our staff. Like many Manitoba families, healthcare workers have been affected by this pandemic in many ways, and including earlier this year when schools and daycares were closed. Our healthcare workers had to juggle many competing priorities, often in new and different settings, trying to arrange for childcare. And as the economy and the schools returned to a new normal this fall, they also supported their children and their families in achieving a new routine. So now as the respiratory season hits and COVID cases increase, they are dealing with incredible amounts of pressure and stress as they do everything possible to keep themselves safe and their families safe and protected, while showing up to care for patients and clients and residents every day. Our staff are incredibly dedicated to caring for Manitobans, and it's why they've chosen this career. But each and every one of them is fearful that their career choice will increase their risk of exposure, and they worry about bringing this virus home to their loved ones. We have said it many times since the spring, but I'm going to continue to say that our top priority in our approach to COVID-19 has been to protect our healthcare workers. They are the most precious resource we have in our fight against this virus, and we are committed to their safety. We are seeing, however, that as cases increase in the community, they are also increasing among healthcare workers. And while the vast majority of our positive healthcare worker cases were contacted outside of work and not in the workplace, there are unavoidable HR challenges that result. So going all the way back to the beginning in March, we have had a total of 218 positive COVID cases involving staff throughout Manitoba. And currently right now we have 37 who have been tested positive. 32 are working in Winnipeg facilities. We have 3 in Prairie Mountain, 1 in Southern Health, 1 in Interlake Eastern, and 0 in Northern Regional Health Authority. 18 of these 37 cases were acquired by close contacts. Many more staff, though, are isolating following contact tracing, which has identified them as close contacts of confirmed cases. Again, many occurring outside of the workplace, but still a significant number and related to, they work collaboratively with our infection prevention and control and occupational health teams. So on Monday, we highlighted a team of staff had to be placed on isolation by misleading responses to screening questions by a surgical patient. And so I want to repeat, we need the public to be honest with screeners and answer those questions honestly. You will receive care. We will not deny you care, but what we need to do is make sure that our workers are protected. As we approach respiratory virus season, healthcare workers continue to screen themselves for symptoms before arriving to work, and in most cases, any symptoms will require them to stay home. And this also is a significant impact on our staffing across the system. We have seen our sick time increase compared to last year. Across Winnipeg Regional Health Authority over the past 2 weeks, we have seen more than 91,000 hours, or about 5.81% of all hours worked were claimed as sick time by staff within the healthcare system. Not all of them clinical staff, but staff within the healthcare system. If we compare that to the 5-year average for the same time period, it is quite a bit lower, more like 78,000 hours. So this increased number accounts for both those isolating after exposure and those who have symptoms and are unable to work. Our challenge across the province has been to plan and make backup plans to ensure we have the appropriate staffing and contingencies in place, not only to manage the COVID surges, but also to ensure that we can maintain our usual healthcare services like elective and non-urgent surgeries and procedures as long as possible. So to accomplish that feat requires a multi-pronged approach. So we are looking at staff vacancy rates throughout the healthcare system. It is complex and an ever-moving target, but we are moving in the right direction. So as of October 18th, we had an overall nursing staff vacancy of approximately 14.5%. And this is an improvement from last year at this time, where the rate was 16%. And what that translates to is an additional 115 nursing positions that are now filled compared to last year. We've also focused on recruiting nurses into the critical care program. And to give you some perspective on this, 1 year ago, the critical care program had a nursing vacancy rate of over 20%, and today it is 11%. There have been 72 nurses who have graduated from the critical care training program between May 2019 and August 2020. So I'd like to congratulate everybody who's been working on that. And there is another course currently underway where we have 39 graduates expected to be employed within the healthcare system in the critical care environment soon. We have also found positions for staff that require special accommodations due to their health and being able to place them in lower risk settings. So for example, immunocompromised staff may be able to work, but not necessarily in their normal place of work. So we look at their skills and experiences and work with them to have them in the right environment, and that might be contact tracing or working with Health Links or the COVID call center. And our focus on hiring is not just looking at nurses. There are opportunities for every position, every profession. Manitoba has 21 regulated healthcare professions, and there are tremendous opportunities for them to work to their full scope of practice with the appropriate training and support within a team-based environment, so that all the healthcare needs of the patient are addressed. Since the start of this pandemic, approximately 350 staffing resources, including nurses, healthcare aides, respiratory therapists, physiotherapists, and others, have been deployed to a variety of roles and settings through the COVID pool. And this really does require a different way of thinking about how we've always worked. And our new normal is now about using everybody's talents and skills and keeping the patient's needs as our focus and their safety as our priority. In the community sector, just to give you some examples, we have already applied this collaborative care model in several different areas in order to free up the expertise of our nurses to help them and allow them to do what only nurses can do. So we now have expert allied health professionals helping in occupational health. There are the additional swabbers who are being trained, and they will contribute to the high volumes that we're seeing in the testing sites. We have volunteers who work under nursing supervision at the COVID contact center, and they follow a script and they contact daily they make contact with the not the positive cases, but the close contacts. And if there's any issues or concerns, there's a nurse nearby to support them. And in the spring, we also were working on identifying healthcare workers who could competently administer vaccines with additional training and within their scope of practice. So this includes licensed practical nurses, registered psychiatric nurses, along with our typical registered nurses, pharmacists, and physicians. As well, we're also working with external partners. So I mentioned on Monday that a small team from the Canadian Red Cross began supporting public health last Friday to help them manage their high volumes and increase the capacity for contact tracing. There are also plans for this organization to scale up its contributions in the coming days. So now we continue to support the community because we believe that's really foundational in this pandemic, but we are shifting focus to acute care now as well. We are actively seeking, interviewing, and hiring term and casual positions across the province in a variety of roles, both in community and acute care. And in the past day or so, we have hired an additional 15 staff for the casual pool. This includes 6 registered nurses, 4 unit assistants, 3 physiotherapists, a speech-language pathologist, and a manager of COVID screening. And since our public call-out, which was just last week, we've received approximately 50 expressions of interest every day since then. So we're very grateful for everyone who wants to help us, and we need your help. The other thing that's interesting on the horizon is we recognize the desire and the benefit of rapid testing for our healthcare workers. And this has potential to offer both peace of mind for those who are working in these environments, but also, and importantly, when you reflect back on our sick time numbers, how we can identify staff earlier who have mild symptoms but do not have COVID, and they can continue to work while wearing the appropriate PPE, protecting themselves and protecting their patients. So rapid testing is an emerging science, and several new technologies are being developed. But currently, we are piloting a rapid testing approach for healthcare workers who have symptoms consistent with COVID-19 who are scheduled to work. As of last week at Health Science Center, 150 symptomatic healthcare workers were tested. 146 of them tested negative for COVID and were cleared to work by Infection Prevention and Control and Occupational and Environmental Safety and Health. So like all staff, they must wear their facility-provided PPE. But there was also 4 staff who tested positive, and now they are at home isolating. So this pilot is being assessed by our clinical experts and could prove to be an important tool as we approach the respiratory virus season, when many healthcare workers may have one or more influenza-like illness symptoms, but do not have COVID-19. So we'll continue to work on dedicated resources to support healthcare workers, their testing, and we'll have more to announce on this soon. And then finally, while COVID is not a challenge that any of us would have wished for, it is a challenge that presents us with an opportunity to think progressively and act innovatively. So a majority of people who have replied to our call out for help are interested in working in the COVID contact center and assisting with contact tracing. But there are a number of other important positions in our healthcare system that are available and safe. This includes, but is not limited to, positions in health links, occupational health, at testing sites, and at personal care homes. The safety of our staff is our top priority. Protocols and precautions continue to be evaluated and updated based on scientific evidence and leading practices. We will never do anything to put our people at heightened risk to this virus. And it does remain safe for people to receive care at our hospitals and health centers whenever they need to. It also remains safe for people to work at these facilities, and we do hope more people will join our team. So anyone who is interested in assisting their community with the COVID-19 response are encouraged to visit sharedhealthmb.ca for opportunities, and your new colleagues are looking forward to having you join them. So in closing, for healthcare workers who are hearing me right now, I hope this provides some reassurance that more help is on the way as we deal with this second wave. The tireless dedication that you have shown to your patients and your profession, and the perseverance over these past 8 months to prevent the spread of this virus. This is why you are called the healthcare heroes. And we need you to, for the duration of this pandemic, we need to do everything to help you be safe. And to Manitobans who are listening, it's important for you to take away 2 things from today. The first is that we are here for you, and we will remain here for you, and our facilities are safe, and if you need care, please do not hesitate to seek it. Secondly, we need you to buckle down and help protect our healthcare resources for those who require serious medical care over the coming months. You may not be at great risk, but your loved ones, your friends, and your neighbors may be. And you have a very important role in ensuring our health system continues to have capacity. So I ask that you please limit your gatherings with those outside your household, practice physical distancing always, wear a mask when you're in public, wash your hands regularly, stay home when you're sick, get your flu shot, and be honest with us about your symptoms or any exposure when you seek care. So we have done it once, we're going to do it again, and this isn't forever, but this is really essential right now. And with that, we can open it up to questions.
Thank you. A reminder to our reporters on the line, you have one preliminary question and one follow-up this afternoon. Up first, from the Canadian Press, Steve.
Steve Lambert from the Canadian Press. Dr. Roussin, you said near the beginning of your remarks today that people should stop socializing with those outside their household. The public health order in Winnipeg talks about a household plus 5. In other parts of the province, it's a greater number. So I'm wondering, do you see that as mixed messaging? And is the recommendation to stop socializing out with people outside your household going to be firmed up in a public health order at some point?
Well, I mean, our public health orders are what we have there to be able to enforce, and so we are looking at increasing our ability to enforce such orders. The messaging, we tailor to what we're seeing at the time, and so right now we're seeing a lot of people, gathering outside their household. The best example is Thanksgiving. And so the public health orders, as we write them, will certainly provide some leeway to that, because we need them to be able to be enforceable. But the messaging is, right now, you should really be strongly considering whether you should be socializing outside of your household right now. We have a lot of community-based transmission. And so we need Manitobans right now to take this very seriously. Many have never stopped taking it seriously, but we need everyone to take it very seriously and reduce the amount of contacts you have starting today.
And the establishments where people can gather socially, some of them are household, house dinner parties, Thanksgiving get-togethers in homes, as you mentioned, but also people continue to gather socially in restaurants and pubs and bars and other locations. Those remain open. There are limits on the seating, but again, it's not household only. Are you considering going code red in the coming days and shutting down establishments like that?
Well, you're right. We already have restrictions on those areas, and those numbers are really to get the message across how important it is. But we have those in place for some time. We're still seeing climbing numbers right now in Winnipeg or through the province for the most part. So yeah, we've haven't taken any actions off the table. If we continue to see these climb, then we'll have to do more than just to message to reduce socializing outside your household. We'll have to increase our restrictions to try to decrease the strain on our healthcare system.
From CTV Winnipeg, Turia.
Good afternoon. This question is for Lanette. You mentioned plans to, hire more healthcare workers, but what's being done immediately to address the staffing shortages that are clearly adding to the strain, and how is the system keeping up with the demand right now?
Yeah, that's a great question. So really in the healthcare system, we go through cycles where there are constraints on our system every year with flu season. So at this point, the constraints are similar to that. There's always been outbreak protocols. There's always been escalation pathways where we need to mobilize staff in a different way. So that is where you're seeing right now, actually, the 43 canceled surgeries in Winnipeg would be how the sites are managing on a local basis to move their resources or manage their resources according to the situation.
And this question is for Dr. Roussin. You've listed several examples of people not following the rules and or public health orders, and that's increasing community transmission. But are these areas where we're seeing more community transmission in lower income areas, maybe racialized communities, places where people can't physically distance as easily?
There is what we see in our jurisdiction and jurisdictions throughout the world is that those in lower socioeconomic status and lower income quintiles are affected disproportionately. So we do in fact see that here as well. We see it related to certain occupations as well, so there are challenges with that. So we've had a number of things right from the beginning to try to increase efforts at places such as shelters, try to increase activity to alternative isolation accommodations. So we are looking at that, but that is an issue in our jurisdiction as well as all jurisdictions.
From City News, Jonas.
Good afternoon, folks. Jonas Gilbart, City News. Lanette, we are hearing about a COVID patient that was an ICCS or was transferred from ICCS at Asper to the main ICU. Apparently, this resulted in staff being exposed there, the closure of all but 6 ICU beds. This is what we're hearing. Can you confirm this and whether there are any available ICU beds? I know you said 92%, but this tip that we got says we could be running out faster than that.
So I did mention at the beginning that our capacity is dwindling in critical care. There is capacity in the system, but I understand that it is more compressed at St. Boniface because of staffing issues. The cancellations at St. B, my understanding is because staff have gone home or were positive. So I don't have a lot of details on that, but I believe that's accurate information.
All right, thank you for that. And Dr. Roussin, this one is for you, sir. We are hearing as well today about a local doctor who have posted in his office messaging that stated COVID-19 is basically like the flu, no more lethal than any cold or flu virus for those. Also says, folks are going to get it, everyone eventually. Have you heard anything about this situation, this local doctor, and without identifying him, of course, and just your messaging on it?
I have not heard that, and we'll look into that because that is, something that will need to be addressed because this is not in keeping with the facts. We see that COVID has had many more severe outcomes than the flu. Certainly the flu is a very dangerous virus. We get it every year. We have a pandemic every year, and we certainly promote the flu shot. We need to protect ourselves from things that we can. But I do not support the message that you just put forward there, and so we will definitely look into that.
From the Winnipeg Free Press, Danielle.
Good afternoon. Danielle De Silva from the Winnipeg Free Press. Ms. Siragusa, I'm wondering, so what happens when our ICU capacity hits perhaps 95 or 100%, and when might that happen?
Well, I wish I knew. I wish I had a crystal ball and could tell you when that will happen. It's always in motion. We do have capacity in medicine right now as well. So I think they're just under 90% occupancy. So the flow of patients going back and forth between critical care and medicine is important to ensure we have that critical care capacity always available. So that's still occurring. If we, the way the numbers are going, we do expect that critical care is going to continue to be congested. If we have to go over capacity, we already are looking at what those models of care would be, and how we would support patients. We're not going to be denying any patient care. We're going to figure out the solutions. It may be locally too, though. That's one thing. Provincially, we are all working together to find solutions, but the first line of defense really is happening either on a unit level or a hospital level, to try and manage the resources from within. And then if it escalates, then we all start working together and making sure all the sites in Winnipeg are working together, all the sites in the province are working together. So we will move patients. And we have critical care capacity as well in Brandon. And those are our two main critical care spots, but we also have special care units that are available throughout the province with highly skilled healthcare workers and all the right equipment there. So really it depends on the level of acuity of the patients and where they're from and what they need, but we will look at all those factors and make sure we deliver.
Thank you very much. And Dr. Roussin, my follow-up question is for you. I was just wondering, would you describe the trend that we're seeing in Winnipeg over the past 4 weeks with the outbreaks in hospital settings and the personal care homes as a failure of the pandemic response, and why or why not?
Well, it's certainly concerning, the trend that we see, and we're not seeing the results that we expected with the restrictions. And when we do the case investigations, it's largely because we're in that type of population. We're not seeing the uptake of the recommendations, or even the orders. So, so with that, we see widespread community-based transmission. We see now that transmission occurring through all age cohorts. We're seeing that into high-risk settings. And so if this trend continues, we'll continue to see that strain on the healthcare system. So we will need to act to get stronger measures in place to stop this rate of transmission.
From Global, Brittany.
Good afternoon, Brittany from Global. My question's for Lanette. When we talk about the ICU capacity and the staffing concerns and issues that we're seeing, we've been told from doctors that, staffing has been decimated in a lot of these areas. How are we finding the extra staff that are not just extra bodies, but are adequately trained, equipped staff to be able to move into these positions and backfill?
I'm not sure what your sources are referring to specifically. In terms of vacancies, critical care hasn't really looked this good in a long time, but certainly I appreciate with people who are having to go home if they're close contacts or if they're COVID positive, that's certainly that absenteeism is what's really impacting us right now. So I do think there's a few strategies. One is that rapid testing, so that we can determine whether or not people have COVID and need to be isolating. But in terms of the people resources to support that, we know that the critical care nurses are experts at what they do. They have skills that not everybody has, and especially their assessment skills of multi-organ system issues. Because when you're in the ICU, it's often not just your lungs. It's actually a whole bunch of things that are going on at the same time. So the nurse is, to me, the quarterback of the care, but there are other healthcare workers who absolutely can check vital signs. Most nurses, I would say every nurse knows how to help out with blood pressure and checking blood sugars and managing, the basic needs of patients. We have respiratory therapists who are experts in airway management, as well as physician assistants. So, and everybody can, like, physiotherapy is necessary. Even if you're in ICU and you're not moving out of your bed, you still need to be moving your muscles. That might be something. Like, there's a lot of people who can do a lot of things, and traditionally, we haven't worked that way. We haven't had to work that way. But if you talk to these regulatory colleges and you talk to these allied health professionals, they know that they can do more. They have scope of practice. So it's really about how do we extend the ability. So the critical care nurse is always the super important, as well as the critical care physicians. But how do we allow them to do what they do, but also have some support to manage the other things that other people can help them with?
Thank you. I'm just wondering if you can put into context for people when we say 92% capacity in acute care, critical care, how many beds do we have, how many are filled, and what is our ventilator capacity, and how many are being used currently?
Yeah, so I haven't got the numbers from Brandon, so I'll just give you the Winnipeg numbers, but there are 71 critical care beds, and I put that in give it some boundaries. It doesn't include pediatrics. It doesn't include our special care units. So it's our true critical care beds. There's 71. We currently have 35 patients who are ventilated. Not all of them are COVID. There's just 35 ventilated patients, which leaves us with about 6 empty beds at this time. And again, people are coming in and transferring out, so that can change moment to moment, but that's last check what we were at.
From the Brandon Sun, Emily.
Thank you. So my first question is for Dr. Roussin. And you had touched on the fact that you're seeing, giving examples of transmission, cited that you're seeing cases where people are getting testing positive for COVID because someone from one part of the province is traveling to another part of the province to visit someone, and so I'm wondering, is there any consideration of either messaging or possibly public health restrictions to discourage people from traveling between communities, even within Manitoba, not just between provinces, but from Winnipeg to other places and vice versa?
Yeah, so we do have the northern travel restrictions right now, which remain in place. So that we don't allow non-essential travel to the north. So that's still in place. And then the messaging now is really find ways to limit contacts outside of your household. So that includes traveling to visit friends and family. And just right now with the test positivity rate, the amount of community-based transmission, we need to find ways to protect ourselves, protect those others. And the best way is to just limit our non-essential travel and limit non-essential gatherings. And so that's really the message going forward.
Okay, and my second question is for Lanette. So you had talked about, you had mentioned that there are 218 positive cases involving healthcare workers at facilities in Manitoba. But then you had also mentioned that there's a number of other staff that are required to isolate because they've been identified as close contacts of a COVID case. Would you be able to provide us with the total number of healthcare workers that are being not just have tested positive for COVID, but that are currently being identified as close contacts and are being required to isolate and therefore unable to be working in the system right now?
I wish I could. I was looking for that information to be able to present to you, but we do not collect that. So the best I could do is demonstrate the sick time that we have. So people who are at home sick, isolating, as opposed to working. So I don't have exact numbers and it's not recorded anywhere, but I was looking, sorry.
Thank you.
From CJOB, Amber.
Hi, we're now 1 month into this level orange, and we keep seeing these cases climbing. At what point are you going to see more restrictions? I know previously we've said a 3% test positivity rate is a threshold. Now we're at over 7. Is there a test positivity rate that we should be watching for next, or what should we be looking for?
So like usual, we won't have a single indicator we're looking at. Look at multiple indicators and trends. And so the test positivity rate is certainly one of those, and we see that trending in the wrong direction and at a concerning level right now. We know we see a lot of community-based transmission, which we follow, and then now we're looking very closely at the demands on the healthcare system. And that's one of our the biggest goals of our pandemic response is to decrease that morbidity, mortality, and decrease the strain on the healthcare system. So as we're seeing that and the trends in the wrong direction, we do need to consider what further public health measures are required to try to reverse that.
Okay, thanks. And then my follow-up question, we've talked to some epidemiologists who say now is the time people should be really, shutting things down. What's holding the province back from even more restrictions, like moving to that level red?
Well, we've never, since the beginning of this, we've always had some level of restriction in, and recently we've increased those, and quite recently increased those in the Winnipeg Metro region, in Northern region, today in Cross Lake. So we have been putting restrictions in. We just know that restrictions, especially things that shut businesses down, that shut sectors down, have huge implications as well on health. It's not just the economy we're talking about, those have huge implications on health. And so, given these numbers, we may very well see ourselves in that area again. But we do so very cautiously, knowing that these have huge implications for us all.
From the Winnipeg Sun, Scott.
Good afternoon to both of you. Scott Billick, Winnipeg Sun. Yesterday, Maples came out and talked about how they did a bunch of sentinel testing at their PCH there, and I think I know your number said something. They had 69 residents there who tested positive without showing any symptoms. What kind of concern does that raise? And should the province be going into every PCH really at this point and conducting that kind of surveillance testing to start cohorting those people that test positive but aren't showing symptoms?
Yeah, so it is a challenge when we have asymptomatic testing. When we have especially a personal care home that is already on an outbreak, that outbreak measures are already instituted in. testing asymptomatic people doesn't change a whole bunch of what we do, because those people should already be isolated. Each resident should be isolated. Staff should be universal PPE, all the IP&C precautions in place. So certainly we need to test symptomatic people. The asymptomatic testing sometimes can be useful. But for the most part, it doesn't change a lot of what we do. You mentioned cohorting, yes, so that could take place, but for the most part, in an outbreak setting, all of those precautions should be in place already. And so the asymptomatic testing, like usual, is at the lower end of a priority.
Okay, thanks for that. And I have a follow-up, but I guess kind of two, because in some of these care homes, there are people who wander, there's people with dementia and stuff like that. So keeping them isolated isn't necessarily, I don't know if realistic is the right word, but that seems to be the case based on what some are saying. But anyways, my follow-up is different on a different parents, coaches, referees, stuff like that. People like that are concerned about, hockey, other sports that are going on right now. Kids or players, I suppose, are on benches with coaches, all in close proximity. You've talked a lot about, limiting contacts, but they're still being allowed to have hockey games, stuff like that right now. Why is that the case when there is obviously all this community transmission? Why allow those types of things where there are, and I know there are restrictions and stuff in place, but I mean, you go to a hockey game, you can see it. Kids are right next to each other, sweating, spitting, all that stuff. Coaches right behind them. Why allow that sort of thing right now, given the situation right now?
So like most of our orders, most of our public health approaches, it's a balance, between that benefit, between that risk of it. Like you said, we do have restrictions, the 25% capacity, and that, applies to things, not only spectators, but into dressing rooms as such. We have seen transmission at sporting events within teams. Don't see really a lot of transmission between teams, meaning, the actual playing of the game seems very safe. But you're right, is that something that we're looking at is that when people aren't actively engaged in sports, and that includes the bench, we're really looking at ways to ensure there's physical distancing there as well. Anyone who knows the game will say that that's difficult, or maybe say that's impossible to do, but we'll have to find a way, or we're not going to be able to continue that right now. So we are looking at that, and that could be a step we're moving forward. So at this level of transmission, and when we're talking about socializing outside their house, that's the things we're including too. We have to be careful at all aspects.
From CBC Radio Canada, Thibault.
Good afternoon, everyone. My question actually will be for Lanette. I just wanted to know if you can tell us how many contact tracers do we have currently in the province, and how many of them are bilingual?
I do not know the number. Do you know the number?
Yeah, so we don't really have the contact tracers are for the most part public health nurses. We do have Canadian Red Cross, Statistics Canada helping out in some of the aspects of contact tracing. So it's really the public health workforce, and how many are in any given day doing the specific work is variable. As far as bilingual, no, I'm afraid I don't have a breakdown for that.
Okay. And Monday, you said that the point of critical pressure on the healthcare system would be when we have to start redeploying staff and decreasing services. Given the pace we are at, how far are we to reach this point? Is it a matter of days, of weeks?
Again, I can't say a specific answer, but I was hoping that we would see the case volumes stabilizing or coming down. If they keep up like this, it could be days. Yeah. We'll have to see. They are and where they need to go.
From CBC Manitoba, Bart.
Hi there, Ms. Siragusa. Since the Victoria outbreak started last Wednesday, other patients started showing symptoms of COVID-19, and they waited for their test results, potentially infecting other workers and people coming to visit them, close family members. Why were these people not isolated? And why wasn't rapid testing that's available in the emergency department used to protect staff and caregivers?
I'll have to look into that, Bartley. I don't know why they wouldn't be isolated, but I certainly will look into it. And in terms of the rapid testing, I don't know. It's not always that easy to just redeploy. There are some limitations. There's a few different rapid testing abilities out there, technology out there right now. Some are limited by the supplies, some are limited by the people, and some are limited by the validity. So I'm not sure why that didn't happen, but we can certainly, on Friday, I'll give you a bit of a report. I'll look into it for you.
Thank you very much for that. Dr. Roussin, what's it going to take? What's the trigger point before the province takes over Parkview Place? How much worse does it have to get?
Well, the taking over isn't really the what we're looking at right now. The region is working with them in daily contact, multiple times daily. They've done an unannounced review of it. So if there was something that the Parkview Place was not doing that we were requiring, then we have methods of getting that done. So it's not just a simple matter of just walking in and taking over care. It's a matter of ensuring that all of the recommendations of infection prevention and control experts, all of the regional recommendations are being adhered to. That's the main issue.
From CHVN, Taylor.
Hi, good afternoon. We've been seeing a lot of comments from people who are asking why the number of cases are going up if people are wearing masks, and they are saying that this is showing them that masks do not work. What do you have to say in response to this particular view?
There's a couple things to that, right? You can't judge the effectiveness of something just based on these numbers like this, right? The simple in epidemiology would say if we didn't have that control, it's maybe the numbers would be twice of what they are right now, but for masks. So that we can't judge whether they're effective or not just based on the numbers that we see. The other thing is that we see transmission in households where people won't be wearing masks. And so, and we've never said that masks were the, in and of themselves, the approach that we need, right? We always said they were an additional measure to be taken, right? Low risk, useful, not conclusively the only measure that we need. So we still need the hand washing, still need physical distancing, we still need people to stay home when they're ill. But no measure by itself will be 100%, but we have that as a measure, and so we should continue to wear our masks.
Thank you. And right now, what is the province recommending for Remembrance Day services?
It's going to be the same, the same approach right now as what we're taking everywhere else. Is we can't have gatherings. Certainly, indoor prolonged gatherings can't occur right now. So this is one of the most important days of the year for Canadians. So we need to find ways to show the respect to celebrate that day, but. We'll have to find smart ways to do it so that we're not gathering with large groups of people and promoting transmission of the virus.
From the Globe and Mail, Shannon.
Hi there. My question is for Dr. Roussin. I'm going to return to the personal care home. I'm wondering, where does the ultimate responsibility for care home inspections lie? It seems like the WRHA points to the province, and the province seems to point to health authorities. Who is responsible for initiating these inspections?
So, I mean, the ultimate responsibility is, with the operator, but it's a shared responsibility, right? So the province has its standards and licensing branch, which, can inspect and can enforce things related to just that, to the overall standards and licensing. The regions are responsible for, the oversight of day-to-day operations and to ensure that appropriate measures are in place. So it's not about pointing to one or the other. It's a shared responsibility.
Then my follow-up is, have inspections increased of care homes at any time during the pandemic? I mean, why are care homes being allowed to self-regulate when there's so many outbreaks?
So there was, because of the early on, like the nature of the first wave where we weren't seeing a lot of transmission in that area, inspections still went on, but were largely taken from remotely, just because we're trying to reduce the amount of people in and out of these PCHs. We still want to try to reduce that. However, we realize that, certain inspections are required, but do so quite safely. So overall, I don't know what the numbers are of inspections. That's we'll have to address that to the regions, or to the licensing and standards branch if they had undertaken these. But it's for the most part, if we're looking at outbreaks within within a setting like that, it will be the region overseeing a lot of the work there.
From the Thompson Citizen, Ian.
Good afternoon, Dr. Roussin. Regarding the number of cases and the increased restrictions in Cross Lake, when you say that there's a large number of close contacts of those cases, like how many people are we talking, like per person or cumulatively?
Yeah, I don't have that data, so you can. Pose that question to our First Nation partners or to FNIB, and they may have a better answer for you on that.
And I guess just to follow up, I mean, what sort of lessons should people take from, Cross Lake going from 0 to 10, possibly more cases now, and the PAW going from, none to 30 active cases in less than 2 weeks?
So it's the gatherings. So again, we mentioned, you heard me say we took the virus, let the virus off the hook, and what I mean by that is that the virus hasn't fooled us. It hasn't been transmitted in ways that we didn't anticipate, or something happened that we weren't fully prepared for. This virus is transmitting in large group settings. So in many areas like this, just large funerals, large amount of people gathered indoor, prolonged contact, and then you see a lot of cases. Ill people going to work for days and days, close contacts, going into healthcare without declaring. So it's just we know exactly what to do to limit transmission, and we have a very good lesson right now in these last number of weeks what happens when we don't follow that. And it's exactly what you see in those in the communities you mentioned, but we see it in Winnipeg, we see it everywhere right now.
Thank you, Doctor and Nurse Siragusa. This concludes today's media briefing.